Good afternoon, and welcome to today's live discussion on race and racism. I'm Michele Courton Brown, host and moderator of this session, and also CEO of Quality Interactions. We're joined today by my friend and colleague, Joseph Betancourt, Dr. Joseph Betancourt, who is the first Vice President and Chief Equity and Inclusion Officer at Massachusetts General Hospital. Joe's also the founder and director of the Disparities Solution Center, also housed at Mass General Hospital, a physician instructor at Harvard Medical School, and a practicing internal physician. He's got a lot of titles that keeps me busy keeping up with them. Welcome, Joe. Last week we had a discussion about COVID and healthcare, and this week has been quite a week. And we decided that we would focus our conversation on race and racism because it is really what is gripping our country. So Joe, why don't I just start with that? Where are you today? How are you doing? How's work? And how have the events of the last week or so impacted you?
Yeah, thank you for that. And I want to thank everybody for joining. I think these conversations are incredibly important. And I'm just going to kind of say a bunch of things. And I guess the most important thing I'll say is that this is history repeating itself. This is, over centuries of this type of violence and injustice that has taken on a whole series of different forms. I'm sad, I'm angry, I'm frustrated, I'm upset, but I'm not defeated. I think, this has been a very emotional time for anybody who cares deeply about this work. It's I can only begin to imagine what I've devoted my career to this. I care deeply, but I don't live in black skin, and I understand that, and I understand that what's happening now, this is still fears and concerns that people carry every day on the street right this minute. It's not like the protests are changing anything. And so, a lot of reflections. One, we have now come full circle. Structural racism was one of the driving factors, among others, that led to communities of color entering into the pandemic with very significant disadvantages. Then the predictions were that they would be impacted disproportionately, and they were, and we were just coming out of it. And then we get yet another egregious, horrible, horrific, visible manifestation of overt racism and murder that, brings us right back to where we started. People stand up fighting the same root cause that got us here in the first place. It's circular. It's incredibly interesting, and I think a couple of things, the names are just the names, and we could go on and on and on, but there was two that Breonna Taylor and Ahmaud Arbery kind of ran under radar because we were dealing with this pandemic. But this was the third kind of in short order, and people have been bottled up. They've been impacted by communities of color, impacted by this pandemic. The potential energy was there, and then we witnessed this happen yet again, just now caught on film, and I think the part that's hardest as a caregiver is that we work to save lives. And in the COVID pandemic, the single biggest thing we were fighting to do was help people breathe. And to watch as we did this fight and came together as a community, and to watch somebody take that away and literally stop them from breathing was just, I think, it's beyond all the terms you could say, insult to injury. It's beyond words for people like me who were in this fight. And so, we were coming out of this, and we were positive, and we were hopeful. Now, celebratory is the wrong word, but we were like, we've turned the corner, our numbers down, and then this happens, and it just reminded us of what brought us here in the first place. And I guess I'll end by saying that, I sent out a message saying, yeah, that I'm sad, I'm upset, I'm frustrated, but I'm not defeated. But man, I'm like right back into like the COVID fire, but just on this next issue, which is a long-standing issue and is a lot harder to fight, which is racism. And somebody said, I'm a boxing fan. Somebody said, you just got to view this as you had a very small minute between rounds, and it's back into the fight. And that's the way I look at it. I think I'm resolved. I think we have a tipping point. We have a window of opportunity, and we need to drive an 18-wheeler through that window. And I guess I'll end by saying this conversation is helpful, but words are not enough. We need to do our healing. And again, I understand my healing. All of our healing is different. You have sons. This is real to you. In ways that it's not as real to me. So we all need to do our individual healing, but we need to get about the business of action, because otherwise all these conversations are worthless, and we have a lot of them, and people are frustrated with conversations. So that's how I'm feeling. And I guess the bigger question, or an equally important question, Michele, is, you and I have known each other for a bunch of years. We've worked together. This is personal to us, and it's certainly very personal to you, because you live this. And like I said, you have sons and you have a husband, and I know this has hit you. So I'm interested in your reflections as well.
Well, Joe, thanks for asking. And the poignant description that you just made around I can't breathe, right? And spending the last 12 weeks helping people breathe, and then having someone take their breath away. Watching that video, that awful, horrific murder for 8 minutes and 46 seconds broke my heart. Listening to George Floyd call for his mother, who we now understand was deceased, is the fear that every Black mom I know lives with on a regular basis. Whether we live in the inner city or we live in the suburbs, whether we live in, on the East Coast or the West Coast, this is personal. This is deeply personal, and it's deeply painful. And a lot of us aren't doing okay right now, emotionally, around that, because it's a lot to hold. And I was listening to our mayor, Joe and I live in the greater Boston area. We were listening this afternoon to a press conference that our mayor, Marty Walsh, held. And he talked about how exhausted he felt this week as he was trying to hold all of these actions that happened, whether it was Amy Cooper or still processing Ahmaud Arbery or George Floyd, and the protest and the anguish, right? And he said he was really tired, right? And it's just a little view into how some of us live every day. Really tired of the spectrum between microaggressions and George Floyd, right? And having to have, if you will, this sort of, I describe it as a ticker tape, right, in my deep recesses of my consciousness around, are my boys safe? Have I equipped them with all that they need to deal with tough encounters? How do they manage and navigate when their dignity could be snatched at any moment? And it's a tough way to navigate. It's just tough. I call it the black tax. And I think that this is a national window into what some of us have to deal with on a regular basis. And I'm tired. I'm really tired.
It's tiring, exhausting, and I'll tell you, I was literally, I was driving hard since early March with focusing on this pandemic and just on this adrenaline push, and the adrenaline was just trying to come down, and I was just trying to say, okay, how are we going to look now at reopening? How do we look at recovery? How do we make sure that there's no disparities there and getting people in? And starting to kind of turn my attention to what are the lessons learned? What do we need to do peri-COVID? Reopening, lessons learned, what's sustainable when this hits, and and it's right back in it. But it's hard, and it's hard because I talk to a lot of my people, and emotions are all over the place, right? I have some of my Black and African American colleagues say, I'm hurting, I need space. I have others who say, I want answers. I have others who say, I want to talk. I have others who want, who are giving rules for people on how to engage them. Like there's a broad spectrum here. And I certainly, you know, I was born in 68, didn't live through 68, right? And when I talk to some of my mentors who lived through 68, you know, and they talk about this kind of this set of conditions, we don't have a month or two. In my view, we have 2 weeks to do things that are bold and courageous in healthcare, that are sustainable, because we have a window of people's attention, I believe, at least in my lifetime, that we've never had. And I think it's, you know, it's hard for somebody, you know, for years we kind of, you know, implicit bias, you know, put racism here, and we kind of, you know, we talk about racism here, but, you know, we're titrating. This is a time where we all need to only talk about racism. This is a time where anybody who doesn't want to talk about it and who's pushing away, who's a healthcare leader, is going to be seen as an incredible outlier.
Right.
And it is for all those reasons that now is the time for us to be bold and courageous and think about not only, you know, what we need to do outside our walls from the standpoint of advocacy for the elimination of all forms of racism, systemic, structural, overt, and the like, but also what we need to do inside our walls. And with the invisible structural racism that we have all around us, that's more difficult for people to put their hands on, right? People say, no, not here, not here. It is time to unearth, yes here, yes everywhere. These are the ways, and let's get about the solutions. That's what this is about. And you know what? If you're tired, then my job is to pick you up. And when I'm tired, your job is to carry some load. That is the journey that we have. But we need to fight. Like, we need to use this opportunity. To me, I'm viewing this just like COVID. Every minute counts. The virus, you know, in my mind, the virus never slept. Racism never slept. But we have an opportunity to at least make another dent. And I'm viewing every minute as precious in what we're going to accomplish over the next 2 weeks.
Yeah. You know, Joe, I'm tired, but I'm also hopeful. And I don't think that you can be a African American professional without having a level of resilience, right? And so all of those things are in place. And we talked last week about not letting a good crisis go to waste. This is our opportunity to disrupt. And I have to say that we got some amazing questions from the audience that we're going to begin to tackle in a moment. But I was really interested in what you thought we can be doing in our workplaces. How can we apply this experience to making better environments, better climates where we work?
Yeah, I want to say one thing before I jump into that.
Mm-hmm.
Right now, people are starting to ask the question, you know, aren't you worried that all these protests are going to lead to the spread of COVID? Right? Mm-hmm. And what we're trying, you know, so we need to be very careful, because there's going to be this kind of blame game that's going to happen, right? If and when there's another spike. And so part of my response is, you know, we're also reopening, and there's risks in everything we're doing. But at the end of the day, this came full circle. And when you talk to people who are protesting, they say, I'm dying of racism every day. You know, COVID I could at least survive from. I got a chance with COVID, right? So you know, people are making their calculations. And so I think it's very careful we need to be very careful as we voice, for the importance of protest, to say, you know what, this is an important time in history. We encourage people to protest with masks and do everything they can, but people need to stand up, and we can't make excuses for standing up. And as it relates to our healthcare institutions, you know, we're going to try to really take advantage of this in a lot of different ways. I think one is we need to speak with clarity and directly about our views outside of our institutions and inside of our institutions about racism, right? With clarity. We need to leverage our power for advocacy around all forms of racism, but particularly in this instance, around significant improvements around the use of force in policing and the guardrails that are put around that. So the advocacy piece on the outside is very important. I don't want to leave that alone. But as we think about our inside, we need to understand a couple things. We need to be very visible with what we're articulating around the importance of this. We need to absolutely understand that people are hurting right now. And you know what? The standard EAP, the standard kind of tools that we have for employees are not good enough. We need to make sure that the mental health care that people are getting is culturally competent, and that's critically important in this time. We need to really, what I believe, launch an effort and we hope to do this, we're going to be doing this, is a policy and practice review of everything we do with an eye towards identifying structural racism. Now is a time to say we are going to look up around every corner, under every rock, everywhere, to identify how structural racism is leading to disproportionate impact of patients. We could call it disparities, we could call it wage inequality, we could call it all these things, but ultimately I think that rigor needs to be done. I think we need to focus on kind of these issues as it relates to science. There's a lot of racialized science that goes on. When I get a result of a person's kidney function, there's a correction for African Americans, right? That is based on faulty science. So we are embarking on a strategy to address all those times where science has been racialized. Certainly to work on disparities, we will really focus on that. We need better reporting and addressing of everything from microaggressions all the way through racism. And picking it up is important, but dealing with it and speaking with clarity and with policies and consequences and really living our values around that is going to be incredibly important. And certainly, I think taking care of those within our midst, including our employees who are lower wage, how do we think about structural racism and wage inequality, and how do we focus on that? So those are just some of what we plan to go forward with. And I think these are all things that are critical. I'll end this by saying that training is going to be a very important part of what we do. And certainly, I think our ability to, but it can't be optional, and it needs to be everyone, because training when left out. We've been at this for so many years. We understand that when you leave it to options, the choir is the one who does it. We need to really say our values are that if I, as a caregiver, need to be trained in patient safety, I need to be trained in implicit bias. I need to be trained in racism. That should be part of my continuing education pathway.
Hard stop, right? And it clearly built into your answer, Joe, was the importance of leadership, right? Leadership at every level of an organization. So we have found that training works optimally when top of the house is really supportive and has a vision for this. And then that can cascade throughout the organization. One of the questions that came up, we got some really amazing questions from participants in the webinar, and we're going to be issuing a blog, publishing a blog that will answer some additional questions in the next week or so, but we're going to try to tackle a few of those now. One of the questions that came up was, how do we get a meaningful dialogue started so that we can truthfully look at racial equity within our organizations? And
yeah,
I think we can.
If you can't get that dialogue done now, you're never going to get it done. Okay, but it can't just be dialogue. Mm-hmm. Any dialogue needs to be, the step 2 of that needs to be, what is going to be different? What are the action steps? And we need to lock in on 3 to 5 of our institution and get that leader. Now is the time to get commitment from leaders on this, right? We talked about making the case, the business case. This country, this globe, I think, is all standing up against racism based on what we've seen, the inhumanity there. And so I encourage everybody to say this is incumbent upon leaders to make steps here. So conversation is important. It's engaging in real conversation, and the conversation should be around, I know we share the pain of this injustice, and the question is, what are we going to do about it that is real and tangible? And listen, in my view, it can't be launching another diversity effort, launching another equity strategy, launching another inclusion. We need a timeline, we need deliverables, we need accountability. That is what this opportunity provides us. It is to amplify everything we've been talking about and kind of at a pace that organizational change allows, and really saying we are committing to these things and we'll be held accountable.
So another question that was raised was, how do we help get everyone aligned in understanding the root causes of disparities so that things can improve?
It's a great question, and I think we've tried to more and more talk about the importance of history. People do not know history. Our history is not taught in schools. People don't understand how the other side of the tracks emerge. We've given fancy words, like social determinants of health, the things that we have known for a long time, delivered policies that have led to housing segregation, income inequality, differences in education, environmental hazards in certain communities, right? So, this is not I've always been a tactician. I've always been someone who's trying to be tactical. I could deliver the hard words, and I do that, but I'm tactical to get people, to bring people along. This is not a time where I believe we need to be particularly tactical. By that I mean, the prettified words that we've used. I think we need to focus on racism. Racism is a root cause for a lot of what we're seeing, and it exists within our worlds. The courage is going to be: are we going to look at payer policies? Are we going to look at how we fill our beds? Are we going to look at hiring and promotion and retention? Are we going to look at the type of training that we make mandatory? Are we going to look at all these things and really put a down payment down on what we're going to do that's going to be different? And I think that's what's going to be really a critical part of this solution.
That reminds me in terms of resources that can be brought to bear. You and I are sitting on the City of Boston's Health Inequities Task Force, really looking at ways that we can tackle our support of COVID in a very coordinated fashion. One of the questions that came up that I'll take a swing at is, speak to the best ways for us to advocate for equitable resources, testing, supplies, treatments, eventual vaccines, within institutions that are located in and predominantly serving minority persons of colors. So one of the things I would say that we've seen work quite effectively is the City of Boston, just as one model, stood up a coalition of leaders to form this task force. The second thing they did was establish a fund that served as a central coordinating function for collecting cash and other resources and disseminating those resources out into the community. And so the community health centers receive sufficient funding to aid their ability to do testing within the community, allowing people to not have to travel long distances for care, provided for multi-language patient education tools in coordination with the hospitals and others. And we've also seen the business community really looking for ways to be impactful. And so every city has a community foundation. And I think that this is an opportunity. We see some of those community foundations stepping up to develop some public-private partnerships to raise money and to direct funds where they're needed. And I think that is the kind of thing that anyone, wherever you are, can access those resources, can engage those leaders around galvanizing resources needed for much needed testing, PPE, particularly as some of these small businesses are opening up. They're already in an economic strain. Being able to access free or low cost PPE is going to be key to economic survival.
Yeah, there's no doubt. I mean, this is the defining challenge, I think, of my career, certainly. And I think it's interesting, right? Because we were focusing on reopening and recovery, economic, and in the healthcare sector. And now, we can't take our eyes off this. So now we're fighting this war on multiple fronts. And it is going to take a lot of energy, but I still have to, as I help construct a response for our institution with many people in our leadership quickly, I also still need to focus on everything that we're doing around recovery, reopening, and our response to this COVID pandemic, because you take your eye off one ball, one ball falls, the next ball falls. And so I think that's going to be an important part of this. We need to think about equity in all efforts and really encouraging our leaders to, if nothing else right now, to have that discernment, to be so deliberate as to say, if you hear any kind of work stream coming up about how we're going to reopen and recover, there needs to be 2 slides on what's being done for vulnerable populations. Equity in all efforts is going to be critical, I think, in this endeavor.
Thank you. One other question that came up is about the importance of training in this moment, and why you believe it's so beneficial at this time.
Yeah, I think, of course, I've always believed in training. I think we in healthcare are a learning profession, so we have a culture that I think supports continuous learning. I think now, and certainly what we're trying to do is we're going to try to lock in a whole portfolio of a learning pathway that include things from, history of race in America to racism, to bystander upstander, to cross-cultural care and communication, to bias in clinical decision making, to general cross-cultural communication. Like now is a time to really get a lot in terms of commitment, because the masses, they don't want small changes, and I think we can't. I would fail my community if I deliver small changes. And training is one of many things that we need to do, but it's a key one. Why? Because there's a lot of people who don't know, who don't have this knowledge base, who don't have the practical tools and skills to be able to engage our communities in ways that we know lead to more equitable care. So there's a lot of people, I'll end with this. There's a lot of people who are saying, what can I do? A lot of allies saying, what can I do? Now's an opportunity to say, learn. I'm going to give you some tools. This is what I need you to do. So a lot of people who before would say, yeah, I don't need that, they're now saying, I want to do something. I saw an injustice. Now's the time to say, here's a portfolio of things that we're going to ask you to do. Do them. And we're going to hold you accountable for doing them. If you really care, hold yourself accountable. Let us know that you've done them. That's your contract with me. And I think that's what we're really hoping for.
So Joe, I'm going to ask you, because we're reaching the top of the hour, any other final thoughts that you want to share with our audience?
I'm tired, I'm pissed, like I'm animated because it's the way I feel right now. I don't have a lot of smiles in me at this moment, but it's in a good way. I think that this time there are defining moments, and these times call for courageous and bold action. And we oftentimes hear in our community, why does it always have to fall on us? It's unfair, but so is a lot of this. But that's what this situation is about. It's sitting on the shoulder, standing on the shoulders of previous people who, to be honest, dealt with a lot worse. We can stand up to this moment, and we can be courageous, and we should be very articulate about our ask. It should hit on multiple issues. It should hit on values and morals and accountability and transparency. It should hit on policies and practices. It should hit on training. It should hit on kind of equity in all efforts. So let's not be bashful. But I think the biggest, the most perilous thing is for somebody to come to us and say, so what can I do? And for us to not be ready. We need to be ready to say, this is what you can do. Here is the list. If you care, you will do this and you will walk with me. And I think when people get tired, they say, oh, I can't even think about what to do. We don't have that luxury right now. We need to be able to quickly get out of this box and articulate what we need to do. And I'll just say, we certainly stand by people in this moment. And we will be having more conversations in the weeks to come.
Absolutely. Well, Joe, I want to thank you for your time today. This has been a great conversation on race and racism. I also want to offer up the resources that you might find at www.qualityinteractions.com. We have a blog and a number of resources available to you. So we hope that you'll hit us up, learn more about us, and we look forward to you joining us next week on Thursday, where we'll continue to have the conversation on implicit bias. Thank you very much, Joe. And to all of you in the audience, Joe, do you want to say anything?
Yeah, thanks for joining. Stay strong. We will we have an opportunity here, and I think we stand collectively as a community to hold each other up. And I'm really hopeful that this will provide an opportunity for us to make some change. It's not going to solve everything, but this is that arc of justice isn't bent easily, and so we have to contribute several vectors over the next couple of weeks. So I thank everybody for being part of this conversation. Stay strong, and more to come. Thank you.
Thank you.